I became a dentist because my dad's a dentist. I grew up being impressed with the clever things he made, the interest he had in helping people, the way he put his head and his hands and his heart together to solve problems. I admired how he made his patients his friends. I am an enthusiastic person. I'm curious. I'm a bit driven. I get a charge from learning about the world and mastering skills. I went off to college and I majored in economics of all things because I wanted a challenge. I thought economics would be the hardest subject I could tackle and still stay in the liberal arts college. I also ended up taking a master's degree in English. But for all that, I always knew from the outset that I would become a dentist. Dentistry pulls together for me many of the things that I love: art and sculpture and science, a little engineering, a little construction, a little detective work. I like making things. I like fixing things. I like organizing things. I like making things better. Even now, when I go home from the office at night, those same impulses still direct me. I write stories and sometimes I illustrate them. I draw with pen and ink and graphite and charcoal and colored pencil. I paint in watercolor. I make stained glass windows and do mosaic walls. I lay tile. I bake bread. I make pizza in a wood-fired oven. It's all part of the same thing. I knew from before dental school that my highest ambition would be to work in my dad's dental office and learn from him. My dad was blessed with golden hands, with a sharp eye, and with an uncanny sense of what works. He's technically the best clinical dentist I've ever known. My dad also has a strong sense of place. His grandfather settled in this valley more than 100 years ago, and my dad's remained committed to the area. I guess I share my dad's sense of place. I was working in a hospital dental clinic in Switzerland in 1987 when my dad called me and asked me to come home and join his practice. I came right back and never looked back. My dad taught me a lot over the nearly 3 decades that we worked together, not least of which is the importance of kindness, of gentleness, of patience and sympathy. My dad taught me the value of volunteer work. He's provided dental care to people in need in such far-flung places as Israel, Honduras, and a little Alaskan village up above the Arctic Circle. Inspired by his example, my daughter Jillian and I traveled recently to India to treat people in a Tibetan refugee camp. Another thing that my dad taught me was to be conservative in my approach to care, which means, among other things, that we prefer to offer the least amount of treatment possible to solve a given problem. As a result, I've never really been particularly drill happy. I really love the feeling of accomplishment of an excellent root canal or a fine crown. I want to offer the best treatment possible, but also the least invasive treatment. Sometimes the best treatment is none at all. I'm not aggressive. I'm not pushy. I've never been a salesman. On the contrary, I'm probably unusually sensitive about protecting and respecting people's finances. I realize that dental insurance doesn't really cover a lot of what people need and want, and I want to find ways to make care available to people. I look for workarounds. I help people stage their care, prioritizing what they want to do, and then getting it done as fast or as slow as they feel comfortable going. I find ways to temporize, keeping people comfortable and looking presentable until they're ready to pursue more active treatment. I tend to be very flexible and accommodating. I'm also quite non-judgmental. People often feel bashful or ashamed at the condition of their teeth, and it's important to me to set them at ease. Not very much shocks me. I realize that accidents happen, distractions happen, and life happens. I'm not your mom. You already know how to floss, although if you don't, I've got some really great ideas. I don't preach, I don't nag. I'm not as interested in where you've been as where you're going. My greatest pleasure is helping people improve, helping someone else feel better physically and psychologically. Several things help me keep on the cutting edge of the dental profession. For one thing, I'm a dental examiner. I'm a board examiner, which means that I administer licensing exams to dentists that they have to pass to practice dentistry. And one of the interesting aspects of that job is I get to travel all over the country visiting dental schools, from Seattle to Boston, from Los Angeles to New York. And along the way, I get to discover firsthand what new ideas and techniques are being taught in all the schools across America. Another thing that keeps me up with the latest developments in dentistry is my activity in dental journalism. I'm editor of the Arizona Dental Association Journal, and I'm associate editor of the Academy of General Dentistry, which is a national organization of dentists dedicated to continuing education. In the course of those jobs, I study trends in dentistry, and I interview dentists around the country on a range of clinical subjects. I'm also a master of the Academy of General Dentistry, which means that I've documented a lot of continuing education, several thousands of hours, more than is normal, which helps me not only stay focused, but stay interested in the clinical aspects of the profession.